Hey, I just wanted to do a little video just to kind of introduce people to our office. We get people calling all the time asking what to expect when they come into Fiorini Chiropractic Center. And so I wanted to put this little video together for you just to help you understand what has to happen. So the first thing that happens usually is that we get a call from somebody and they've seen one of our videos, they've heard about Atlas Orthogonal, or they've heard about us being in Tallahassee for over 28 years, and they want to come in, they've got some type of a problem. You could pick any kind of problem, be it neck pain, headaches, dizziness, vertigo, lower back pain, sciatica, that type of thing. So just pick one of those things. Now, typically they'll call to the office to make an appointment. Now, usually one of our very great employees that's usually at the front desk will answer the phone, and of course they'll answer it, Fiorini Chiropractic Center, how may I help you? And one of the first questions obviously is that they want to find out what your name is. It's very, very important for us to understand who we're talking to. And so they want to be able to call you by name and that type of thing. So when you call, give them your name and tell them what you want. Now, a lot of times people will say, so what can I expect? So here's what you can expect when you come in for your first visit with us. First of all, you're going to stop at the front desk just like you do at any doctor's office, any health professional's office, and you're going to get some paperwork. We have what's called a kiosk. It's a computer kiosk, and it'll ask you some questions. What that does is it automatically populates a form that's in the computer so that when the doctor walks in with you, they know a little bit about what your condition is and what you're there for. And so you fill that out. It usually takes 15, 20 minutes. And then what happens is you'll be taken into a consultation room. That might be one of our treatment rooms. It might be a room that's just got a desk in it and that type of thing. Excuse me. But at any rate, the doctor's going to sit down with you and they're going to talk to you about what brings you into the office. They're going to, find out how long you have been having this problem. They want to find out what makes it better, what makes it worse. Excuse me. They want to find out if you have any radiating pain. They want to know what kind of pain it is, the quality of the pain. Is it dull? Is it achy? Is it sharp? Is it stabbing? What exactly is going on with your symptom that we can find out. We want to know how severe it is. So on a scale of 0 to 10, 0 means you don't have any pain, obviously, and then 10 means you're at the emergency room. That's how bad the pain is. Some people have described it as the type of pain you might have if you're having a baby, that type of pain. So 0 to 10. 0 means no pain. 10 means the worst pain ever. So typically, if you've got 10 pain, you're probably not going to be in our office. You might be at the emergency room, okay? We understand, but we want to know what the pain feels like to you. And so that's why we ask those questions when you first come in. So we also want to know the timing. Is it worse in the morning? Is it worse in the evening? Is it worse in the afternoon? Is it worse after walking? Is it worse after laying down? What exactly is going on with your symptoms, no matter what they are. So it might be pain, it might be numbness, it might be just not able to do some sport or something like that. So after we do that, we'll ask a few more questions, find out exactly what's going on with you. And then basically what we're going to do is we're going to explain to you that what we need to do is we need to do an examination. And what we're going to find out is this something that we can help you with? Are you a candidate for what we do at our office? And so we will more than likely take you into our examination room, and one of the doctors will come in and do an examination on you. Now, what does the examination entail? The examination entails what's called a chiropractic, orthopedic, and neurological exam. So chiropractic exam, what we're doing is those things that we learned in chiropractic school, feeling the muscles, finding out where there's spasms, where a muscle might be flaccid, it's not working the way it's supposed to. Ranges of motion in particular areas of your body. Obviously, bending your head neck forward, bending it back, bending it from side to side, turning it from side to side. We want to find out how well you can move. We'll do reflexes, we'll do your heart rate, we'll do your blood pressure, we'll do your height and weight, and your pulse, what's called pulse ox, okay, or your oxygen concentration. We want to find out what all of that stuff is. We do some orthopedic tests like an orthopedic doctor would. One of those is pressing down on top of your head, lifting up on your head, bending your back backwards to one side, back and to the other side. We want to find out what makes the pain worse, if it is pain. We want to make sure we understand what it will bring it on and that type of thing. We'll also do some neurological tests on your reflexes. One of the tests that I like to do is what's called the Romberg's test. You're going to be standing up with your feet together and close your eyes. We're going to be standing there, so in case you fall, we can catch you. But that's one of the tests that we do for what's called the cerebellum, which is in the back of your brain. Now, after having done those, we do a chiropractic leg check, both laying on your back and laying on your stomach. And then we also do what's called the scanning palpation, which was developed by Dr. Roy Sweat up in Atlanta, Georgia with the Atlas Orthogonal Program. And we're feeling over the areas of nerves that may be impinged, that may be irritated. And we're trained to find out which areas are having the most problem there. Then, if our associate did the examination, the doctor who's going to see you will usually come into the examination room, and we'll discuss what the associate found. We'll do a couple other tests probably to familiarize ourselves with your case, your examination, and then if we feel like we can help you, most of the time, we're probably going to recommend that we get some x-rays. Now, it might be of your neck, it might be of your back, it might be of your middle back, it might be, we don't know at this point until we do an examination. After the examination, we can find out. So let's say we found a problem in the neck that we think we can help. So we send you down to our x-ray room where we take precise digital x-rays. Our x-ray machine is aligned perfectly. We want to know exactly how much a bone is moved out of place, if it has indeed, and we want to know how to adjust it. Then typically we will send you home. Now, the reason why we don't go ahead and get you adjusted in that same day most of the time is because we need to study the examination, we need to study the consultation findings, the examination findings, and the x-ray findings, and any other diagnostic imaging that you might have, whether you might have an MRI, you might have a CT scan or anything like that. So we want to go over those things so that we can find out what the underlying cause of your problem is. You see, if we don't go over all those things, that might be why you still have the problem. You might have seen other doctors, other chiropractic doctors, other medical doctors, you might have seen acupuncture, whatever. We want to find out what somebody else may have missed, and not in a negligatory type of way, but just something that maybe they weren't looking for. So we want to find out what that is. So we want to study those things. Then typically we'll bring you back the next day or the day after. We try and get you back in within a day or two because we know that you're having these symptoms and you wouldn't have come in the first place if they weren't bothering you. What we do then is we have you come into our consultation room again. We may have you watch a little informational video about the type of technique that we're going to use with you. And then the doctor will come in, go over the consultation with you, make sure that you know that we know what's going on with you, go over the examination, tell you what that means, and then we'll go over the x-rays and tell you what that means. Now, one of the things that we want to make sure of is we want to explain to you exactly what we're going to do and have a plan for what we're going to do. Now, typical care plans run anywhere from 4 weeks to 6 weeks, initial care plans. Now, what does that mean? That means we want to keep track of it over that period of time and then do a re-examination at the end of that period of time to see if there's anything that needs to be changed, or do we need to refer you out, or are you all better? We don't know. So at the end of that care plan, we do a re-examination to make sure that we know exactly what's going on. At the time of the report of findings, we're going to tell you what adjustments we need to do. We're going to tell you what type of follow-up exams, what type of follow-up x-rays you might need, and then also what kind of therapy you might need, as well as home exercises or exercises in the office. And then we go from there and we do the first adjustment, and whatever the post things that we have to do. Most time when you get all the time when you get the atlas orthogonal adjustment, after the first time, we're going to do what's called post x-rays. We want to find out what we did immediately, which is not like a lot of chiropractors do, and not running anybody down, but that's just the procedure that we have, that Dr. Roy Sweat taught us. And we want to find out what's going on with you. You'll typically get your adjustment, get the post x-rays, and then do some therapy. And then we send you home. We give you some recommendations for what to do at home. It might mean using ice. It might mean resting for 45 minutes or an hour. Or one of my favorite things to say is don't lift anything heavier than a fork. We want to make sure that you don't throw this area back out of position. And that's pretty much how the first 2 days go when you come into our office. Typically after that, we'll give you a care plan, like I said, how many weeks and how many visits you might need to get the maximum results. And then, of course, we follow up with you after that. So just a short video to explain a little bit how our office procedures work. And if you have any questions, you can obviously call the office, or you can email me directly. You can Facebook message me, or just call the office, and we'll be happy to answer any questions. So I hope this answers a lot of your questions. Have a great day.